So good evening, everyone, and welcome. My name is Lotus Maroof, and I'm a current third-year medical student here at Al Faisal University, and I'll be your host for today's session. Inshallah, today we will be doing the KSA surgery residency panel talk, and we chose specifically this talk because we know choosing a specialty can feel overwhelming, especially with the amount of mixed advice out there. And for today's talk, our goal is to give you a clear, honest insight directly from surgeons who have gone through the process themselves and understand the realities of training in Saudi Arabia. Today's session, again, to reiterate, is the KSA Surgical Residency Panel Talk, and it's designed to be a practical and relevant talk for interns and medical students who are interested in applications next year, inshallah. So to introduce our speakers, inshallah, we will be having four specialties today with us. First of all, we have Dr. Abdulaziz Alaklabi, cardiac surgeon, Dr. Tariq Saleh, a neurosurgeon, and Dr. Hassan Altalag, a urologist, Dr. Abdulaziz AlMosa, a plastic surgeon. Please give them a very warm welcome. We're really honored to have them here, be with us, and be our speakers for today's talk. Now, throughout the session, we'll be discussing specialties in Saudi Arabia, and we will be beginning by speaking a little bit about the residency process. The way this talk will be divided is each specialist will be talking about details and key points to highlight their application process and what makes it stand out compared to the normal streamlined application process that all of the residents or upcoming residents have to go through. Doctor, you can take the stage now.
Okay, good evening. Thank you for the introduction. My name is Hassan Altalag. I'm an Faisal graduate from the 12th batch. I'm currently in R1 in Urology in Prince Sultan Military Medical City. It's my pleasure to be here to talk to you about the match and answer all your questions. If you have any question at all, feel free to ask. All right, I want this to be an interactive session. I'll tell you all about my experience so far. It's only really been 4 months, but I can hopefully give you an insight on how it's been and the match process, of course. Okay. Next slide. All right. So for the competitiveness and selection criteria for urology, it's on the higher side score-wise. All right, I'll talk about the score later on. Mainly due to less seat availability compared to more general specialties like GS, internal medicine, family medicine, etc. Typically, there's 40 total candidates nominated. Last year it was 40. The year before, I'm not sure. For 6 total centers, I'll talk about them later on. Each center accepts 2 to 6 residents, and not all seats are sponsored. What that means is you might have to get a sponsor from outside, for example, during a service year. All right. And that would be what pays for your program and gives you your salary. I'll talk about that later on. If you have any question about it, feel free to ask. So let's say it is more competitive than GS, but other surgical specialties are much more competitive, such as Ophtha, NT, and Ortho. Next slide. So just like any other specialty, the match is scored based on your GPA, SMLE, and CV. Especially for a fresh graduate, the SMLE holds the highest value. So it's very important to get as high a score as possible, preferably above 90, especially for more competitive specialties. The GPA is obviously also important, but as you can see, it's almost half as valuable as the SMLE. Now for the CV, as a fresh graduate, you can only really check 2 things off the list, the publication and the volunteering. And you only need 1 of each for the points. So it's very important that you don't miss out on these points. All right, try to get a publication before the match. Like for when it comes to research, even non-published research is important to the programs. Like they will see your unpublished research as interest in research, and that's a positive. But you only really need 1 publication. All right. Obviously, if you don't match the first time, there's no shame in that, of course. You can do a year of service, for example, which would get you a lot more points. And it's basically a necessity for specialties like ophtha, for example. As you can see on the right, the lowest score for Euro in Riyadh last year to get accepted in the match to make it to the interview process was 82. For reference, GS was 76 and ophtha was 90. So it varies based on specialties.
By
Next
the
slide.
way,
As for the CV, you want to keep it brief, preferably 2 pages, where you focus almost completely on things relevant to your specialty. Electives, for example, as you can see, would be just urology electives. You want to put research mainly relevant to the surgical field, along with the journal it was published, if it was presented in a conference, for example, if it won any awards. Then you can mention any conferences you attended, such as for me, it would be the Saudi Urology Association conference. It would obviously show that you're interested in the specialty, and it would show that you've been interested, you've been reading, you've been interested in the newest literature, for example. References, I recommend having at least 3 to 4 references from consultants you've worked with, and know you're a hard worker, and they can vouch for you, right? So even in centers that you have not worked with, you can they can still know that you work hard. Volunteering, of course, very important. Uh, Shows what kind of person you are. Same with hobbies and skills. You don't want to show that you're a robot. For example, sports, other hobbies. Show that you have a life outside of work. Certifications, basic operative surgical skills, for example. Um, that's basically it for the CV. I'll talk more about it in the next slide. Next slide, please. So for the interview, it's typically 5 to 10 minutes long. You'll walk into a room with a committee of consultants, sometimes even 6 or 7 consultants, and usually the chief resident is with them. You'll give a very brief introduction about yourself, what university you graduated from, uh, things like that, why you chose medicine, why you chose urology, for example. They won't always want you to go that in depth. They'll tell you when to stop and they'll ask you questions. One of the most common questions I heard was, why did you choose urology? And I would answer that I like the mix of medical and surgical, the variety of surgeries. They have robotic, microscopic, ureteroscopic surgeries, for example. And sometimes I would tell a story of an interesting case I encountered during internship, right? Like I would be like, oh, I met this patient once, and uh, this case was interesting to me. The way this patient reacted when I gave him the news of his fertility results, for example, after a surgery, things like that. They really like that. Other questions, why do you want this center? Very important that you research the what makes this center special. For example, KFSH, you would be like robotic surgeries. They excel in reconstructive urology. They excel in oncology. The more advanced cases, one of the best centers in the world when it comes to research, when it comes to this, when it comes to that. And for other specialties, you would do the same. Or for me, for example, Prince Sultan Military Medical City, I would be like, the program is excellent, the teaching, the environment, the consultants were excellent. My experience during my internship was excellent. And when it comes to the match, the main thing they care about is how hard you work. So typically, the centers that would really think of you would be the ones that you've worked with, right? So they would know you. They would uh like you want to work with as many consultants, as many residents as possible. They would tell the others that you're a hard worker. You do this, you do that. Like medical knowledge is not something they really focus on during this interview. They just want to know that you are committed and you will work hard. They might ask you a few medical questions, right? Like for me, they ask me types of kidney stones, for example, very basic management of BPH, but they won't really go in depth and they won't base their choice on the medical questions. For research, Obviously, in your CV, you put all your researches. Just make sure you know them very well, because they will ask you, "Oh, this one? What type of research is it? You published this in 2025. Can you give me a brief explanation of this research?" So you want to know your research very well, and you want to show that you are interested in research. This is like obviously the future, right, of the field. So they want people who will work in improving, in like representing their center in conferences, and you want to mention that in your interview. Okay. Any question? Okay, next slide. For the residency itself, it's a 5-year program. The first 9 months are all GS. So as for now, I've done 4 months of GS. After that, it's 3 months of ICU. That's for R1. So we don't touch urology until R2. In R2, we'll have 1 month of ER, 2 months of electives such as radiology, urogyne, for example, and the rest of the year would all be urology. And R3, 4, and 5 are fully Euro, right? So for now, for me, pure GS. So if you have any question on GS, I'm more than happy to answer. I know that's probably what most of you are interested in. For the subspecialties in neuro, it's a very actually broad specialty, in my opinion. There's andrology, which is mainly infertility, erectile dysfunction, etc. Endourology, mainly focused on kidney stones, you know, PCNL, very interesting surgeries. Uro-oncology, self-explanatory, bladder cancers, testicular cancers, kidney tumors. Uh, they'll do a lot of nephrectomies, reconstruction, bladder augmentation, for example, like patients with neurogenic bladder, they can't void properly, right? So they might take part of your small intestine to reconstruct that bladder. Very interesting surgeries. As for neurourology, very similar to reconstruction in the cases they manage, but it's different in the sense that they focus on the neurological aspects of it. One of the most interesting surgeries I've seen um, is in neurourology, which was sacral neuromodulation, where you externally control the bladder's contraction via a device in the spine. Any questions on this? All right, we can move on to the next slide. So there are 6 total centers uh, in Riyadh for urology. King Saud University Medical City, King Saud Medical City, King Fahd Medical City, KFSH, Prince Sultan Military Medical City, National Guard Hospital, and Security Forces Hospital. All these have their ups and downs. Uh, when it comes to competitiveness, for example, King Faisal would only accept 2 to 3 residents. Only 2 of these slots would be sponsored. Prince Sultan accepts 6, even though only 3 of these slots are sponsored. So for me, for my batch, even though they accepted 6, only 3 of us had sponsors. So only 4 total managed to make it to the program. Um, so like that. The environment, you'll have to ask residents in other hospitals, honestly. But for me, the environment in Prince Sultan is excellent. The great academics. That's why preferably you'd want to have variety. Don't put yourself in one zone. Like, I want to go to King Faisal Specialist Hospital because it's the best, right? You want to try as many programs as possible. Try out King Fahd, for example. Try out KFSH. Try out Prince Sultan. The different environments would guide you, right? And you'd have different references. You'd know more people in the field. Obviously, connections are very important for matching, right? You go to the interview, they know you well, they know you work hard. It's better than going in, they've never seen your face, you know? Usually, by the way, for interviews, they've already picked the people they want before the interview. So a lot of the time, for example, in King Saud University Medical City and National Guard Hospital, the interview was very quick. They knew they basically already selected their candidates. So it was just a formality, right? Um, so yeah, try to have as much variety as possible. They will ask you in the interview, why didn't you come to my center? Why do you choose this center instead, right? So I prefer if you can do at least 3 to 4 different rotations, different sensors, instead of tunnel visioning into one sensor, like doing 2 or 3 in King Faisal instead of having variety. Okay. I think that's it. Any questions?
I have a question.
Yes.
So, thank you, doctor. What about the exams for urology? Are there any like board exams for urology, and is it hard to manage with the residency?
Of course, the residency is very hectic, and yes, there are exams. Uh, for Euro specifically, there's 2 in the first year. I mean, it's not like you don't have to do them in the first year, but there's the part and there's the promotion. The part is generally GS actually, because our first year is mainly GS, and the promotion would be a mix of GS and urology. So it's important that I study both GS and Euro, even though I wouldn't really have to worry about GS in the future. And it is hectic, obviously, on call. Oh, I forgot to mention, uh, during your internship, I highly, highly recommend that you take as many on calls as possible. For me, I was at the hospital 24/7 during my urology uh, rotations because, like, that's how you experience the specialty, right? Like, you don't know how it feels, how hectic it is, unless you've done the on calls. And surgical fields are very hectic. Um, I actually had one of the residents in my team. He was an R1. In the second week of residency, he dropped out of the program. It was he just realized that it wasn't for him, right? And there's no shame in that, of course. So I recommend like have good motivation for joining your specialty. Like be sure that you want this before you join because you'll be doubting it every day. I don't want to demotivate anyone, but you have to like know for sure that you want this. And it will be very hectic. You'll have to manage your time, your studying, your work, your working, your research, right? Your personal time, hanging out with your friends, with your family. You'll have to keep all that in mind. But yeah, you will find time and you'll have to make use of it, right? Like between cases, like, oh, you finish a day early, uh, open up a book, right? Open up the literature, right? You'll find time, but it is hectic. Any other questions? How can you be a memorable applicant when you rotate with different teams? Uh, I mean, I think I understand what you're saying. Like, for me, during my rotations, I try to be with as many teams as possible during my month, right? So a week I would be with andrology, another week would be with oncology. Uh, it's just important that you show the residents that you work hard. It's not really about the consultants mainly, because the residents will be the ones that really tell them, "Oh, this guy was great. This guy was excellent. You should choose this guy." Um, so yeah, you just want to show them that you work hard. All the residents, work with all of them, be on call with all of them. I was on call with every single junior resident, and they vouch for me in front of the consultants. So that's how you're memorable with the residents mainly, right? And don't just be with one team. Of course, a lot of programs, or like during internship, a lot of hospitals they'll force you to stay with one team. I recommend trying your best to work with as many teams as possible, especially if you're just doing 1 month in that hospital. Okay. Any other questions? Okay. Thank you so much.
Thank you so much, Dr. Hassan. That was Hassan. That was amazing. And moving on, we will be going into cardiac surgery, and this will be given by Dr. Abdulaziz Alaklabi. And he will be sharing his screen soon, so please give a warm welcome.
Assalamu alaikum. Can you guys see my screen? So to start off, my name is Abdulaziz Alaklabi. I'm from the 12th batch of Faisal. I'm currently an R1 in cardiac surgery in the Prince Sultan Cardiac Center here in Riyadh. And today we'll be talking about, inshallah, the match process, the specifics about the specialty, which I'm sure most of you are probably unaware about. We'll talk about it, and at the end, if you have any questions, I'll be free to answer them. Okay, so let's begin. So starting off with the competitiveness of the specialty. Last year, we only had about 6 total candidates nominated in Riyadh last year, and only 2 to 4 seats are accepted in Riyadh per year. So this is something to keep in mind. And our score is around above average, to be honest, 84% cumulative score. So as you can see, there's not that much seats per city and in the specialty in general. So that's something to keep in mind if you want cardiac surgery. And of course, selection criteria, we'll talk about this more in details, but these are the things that you need to keep in mind. So electives, LORs, your research, and of course, the interview. So the scoring. So of course, my colleague Hassan, he spoke about this before, and there's not really much to talk about, صراحة. But again, as we said, as a freshman, the SMLE is very important. Your GPA, of course, you can't really change this if you're an intern or whatever. But if you're a junior, focusing on your GPA, focusing on your grades early on is pretty important. And the CV, again, there's only a certain amount of points you can get as a freshman. You have to try to maximize the amount you can get from the score. And as we can see in Riyadh last year, it was about 83.6, and it was actually increased around almost 2% from the year before. And these, you can see the averages in the other cities, but pretty common is that Riyadh always has the highest when we're talking about different specialties. Okay. So what are the most important components in a CV? So of course, you can see I put 2 stars on this, which is the electives. Especially in a surgical specialty, the team needs to know that you're a hard worker. And truly, what that means is that you are there 24/7, honestly. I had about 3 months of cardiac surgery starting from December all the way to February. And yeah, I was in the hospital for those 3 months completely. So you're there all the time, you're taking extra on calls. Sometimes, some months, they won't even assign you on calls. But I went out of my way to work, to do on calls, to be there in the afternoon, be there at night. In our specialty in cardiac surgery, we have a very hectic lifestyle, to be honest. So compared to GS and compared to other specialties, we have our daily hours are already long. So we're there from the morning. Typically, surgical specialties are there in the morning after Fajr. And depending on if you have a 1 case or 2 or 3, a typical day you could be finishing work at Isha time at 8 at 9 p.m. That's like on average. On calls are not as hectic, but they are still, on calls. So it is what it is. But you're not managing as much inpatient work. So that's another important thing. So there's a lot more OR exposure. So of course, if you love the OR, that's a bonus. But you need to keep in mind the hours. So it's a lot longer than, so our lifestyle is worse than GS in terms of the hours. But in terms of the actual workload, There's a lot more dirty work in GS, so that's something to keep in mind. So electives, again, as we said, so it's very important to show your face. They have to know you. Centers will most likely choose a resident that did elective with them. Almost 90% chance, if not above that. So try to do as much electives in different centers as possible so you can show your face everywhere. Research is another component which is important, mainly in your CV. Again, you only did that one research to get the points in the match, but in your CV, it's a good bonus. Your LORs, your references, of course, extracurriculars showing that you're working on charities, you're volunteering. It shows what kind of person you are, صراحة. And then, of course, conferences and courses. So this is a surgical specialty, so they care about, conferences and different surgical courses, and that you have surgical skills, especially cardiac surgery. It's much more important in our specialty than other specialties, صراحة. Your basic surgical skills have to be very high. This is highly emphasized on, and we can see from the beginnings how what's your potential, kind of, you could say. Other specialties like GS, whatever, you can kind of make do. There's average surgical skills. You don't have to be something amazing, but in cardiac surgery, you have to be the best of the best, صراحة. So the next we'll talk about is the common mistakes and frequently asked questions during the interviews. So during the interview, of course, the most common question is tell us about yourself. So you should, talk about your background, talk about how you reached this level. Make it into like a story. I think that's my recommendation. Try to have like a smooth story. Don't memorize your answer. Make it smooth. Talk about the bonus points. What were you good at? What you achieved? Any specific things that you want to highlight on. Where you did electives, and at the end, always end off. Now I'm at the phase of applying for this certain specialty at your center, etc. And then, of course, the other common questions are, why did you choose cardiac surgery? So you have to have a good answer for that. Why choose a specialty? Because as we can see, there's less seats. The specialty, there's a lot less surgeons coming in with the progress of interventional cardiology, a lot of endovascular interventions that are up and rising. So you have to have a really good reason of why you want to be a cardiac surgeon, okay? And of course, what do you want this center specifically? So you cannot just say that, there's a basic answer. You have to have really specific details that you know about the center. Oh, this center, it has a lot of aortic surgeries, for example, or they have a lot of transplant, etc., etc. They're focused on resident training, all these specific details that prove that you're actually focused on the center and you're not just doing an interview there for just to get a seat. Your electives, of course, we talked about this before. Other questions that may arise is like how you can resolve a conflict. Tell us about a conflict that happened during medical school, etc. And then research questions, of course. So what research are you working on? How did you publish this research, etc. Those are common questions, Sarah. So the residency duration. So this is a 7-year program. So this is technically the longest program in all of medicine. It's divided. So 7 years is in Saudi. Outside is about 6 years. So in Canada, the US is about 6 years. So one additional year. And it's divided. So this is the outside rotations that you'll be doing. So the first 3 months is going to be cardiac surgery. So that's different from our colleagues in neurology. We get exposed in the first 3 months in our specialty. You get to work. They depending on of course, the center. You get to work. You're always in the OR, etc. And then now I'm currently outside doing GS. So you do about 6 to 8 months of GS and trauma surgery. You do 6 months of ICU, which is very important for us. And then you take 10 months total of vascular and thoracic surgery, which are basically cousins to cardiac surgery. And talking about the subspecialties, it's a wide variety, honestly, but it's technically divided between 2 specialties. So you have 2 pathways. You can either choose to go to the adult, which is more common, or the pediatric or the congenital heart surgery, which is more complex and definitely more meticulous. So the congenital cardiac surgery specialty, It contains of one fellowship, which is this pediatric cardiac surgery, and then also transplant. So you want to be a transplant surgeon because they work a lot with children with heart failure. They reach a point where they need a transplant. So you are going to be giving them transplants and this kind of thing. Adult is much more diverse. So you have general cardiac surgery. This is the majority of the specialty. Your coronary artery bypass grafts, your cabbages, your single valve, your double valve surgeries, your mitral and aortic valve. And then we have other fellowships. So we have aortic surgeries. So this is very interesting. This is all, surgeries pertaining to the aorta. So if you have aortic dilatation, so that's going to be, you're going to change the aorta in that case, aortic valve surgeries, etc. So that's a fellowship on its own. And then we have another fellowship, which is the minimally invasive and robotic surgery. And this is really progressing, and robotics is really coming into our specialty. So this is probably the most up and coming one, and it's gonna take over, of course, and it's gonna be the majority of the cases in the future. And then you also have heart failure and transplant in the adult as well. So what training centers are available in Riyadh and outside Riyadh? So there's only two centers here in Riyadh. So I'm in the Prince Sultan Cardiac Center, and we have King Fahd Medical City. So these are the only two programs available in Riyadh for cardiac surgery. There used to be KFSH in Riyadh, but it closed. They closed the program. Al-Haras used to have a program, they closed, and Al-Jam'i or King Saud University Medical City also used to have a program, but they closed. So now there's only two programs here, and that's Prince Sultan and the King Fahd Medical City. Outside Riyadh, we have the Medina Cardiac Center. We have the program in Mecca. We have around, I think, two programs in Jeddah and one program in the Eastern region. So in total, there's not that much seats. So you have to keep that in mind, and you have to really think about whether you want the specialty or not. So if there are any questions, I'll take questions from now. Let's see the chat. Is there any questions? Okay, if there's no questions, we can move on to the next, I think.
Doctor, there's some questions available in the chat.
Okay, yeah. So what's the difference between applying for a program in Riyadh versus outside? So basically during the match process, of course, and you apply basically to the city. So you don't apply to centers. So once you apply, you choose your specialty that you want. So cardiac surgery or any other specialty, and you put in your preferences. So you choose, I want this specialty. My first choice is Riyadh. So I want to do it in Riyadh. And then the next choice would be Jeddah or Medina or whatever. Or let's say you don't want. So you only want Riyadh, and if you don't get Riyadh, you don't want anywhere else. So you can also do that. That's during the match process. During the actual program, of course, programs they differentiate quality programs, etc. Of course, once you get deep in the specialty, once you do your electives, once you see how the residents are working. Is it a resident-oriented program? Are the residents getting hands-on training early on? Are they progressing? It's very obvious, صراحة, and especially in our field in cardiac surgery, our work is almost all OR based, يعني. All of it is operative. We don't have that much clinics. It's ICU. Our patients go to the ICU, etc. So we have cardiac ICU who are monitoring our patients. For surgical skills and resident training is very important. So you can only tell this once you get deep into the specialty and you do your electives. You talk to residents, how is the training here versus other programs? And you should really have what you call, like I call, يعني, a wide, a range of, like ranking programs. You should rank programs based on resident training. That's how I see it. So, Allah, I know this program, mashallah, they have the best training for residents. So that's my number one. And then I rank it by the resident training. So in Riyadh, of course, Prince Sultan Cardiac Center is probably the best program here, honestly, in Saudi Arabia. King Fahd Medical City is a good center. But I would recommend Medina and Mecca. They have very strong programs, which a lot of people don't know about. But again, you only know these details once you experience these programs and you see the residents and you see the graduates. Are they getting jobs? Are they getting fellowships, etc.? So that's the key thing to think about. What's expected from you as an intern versus a resident interested in a specific specialty? What is expected from you as an intern? So as an intern, it's being available. So availability is like the number one indicator, صراحة, of not hard work, of interest. So they have to see that before they see you're a hard worker, they have to see that you're interested. So, يعني for me, I would rather be in an OR for 15 hours than 3 hours of family medicine clinic. That's just me personally. But how do I show that? By being available. They won't know that I prefer this over that if I'm not there all the time. صح? They expect from you is interest. So how you show the interest, it depends. You're always there, you're always helping out. It's a balance. It's a balance in surgical specialty, there's a balance of being interested at the same time. So you ask questions, but you don't ask too much to the point where you're almost annoying, صراحة. And you're not asking too little where it doesn't seem like you're interested. So there's always like this median balance of being interested in the specialty. And of course, surgical skills is something that's important as an intern, even as an intern, صراحة. So that's also something to think about. Doing boss beforehand, having good skills beforehand. This is all some key things that really differentiate between two interns. If they have the same exact CV, but how they work with the team, how their surgical skills are, how their communication skills, it makes a big difference, صراحة. So as a first year medical student, the first thing to do is focus on GPA, of course. Any other things I need to follow so I can be ready to apply. Of course, whoever has asked this question, as a first year medical student, the last thing you need to think about is right now is residency. You should be focusing on your grades, focus on exams, keeping your GPA up. That would be my focus early on. And then once you get into your third year, that's when you should start focusing on, oh, can I do electives, observerships, getting to know, the different teams, etc. And then a certain key things I would say if you want cardiac surgery specifically is to begin from very early on with surgical skills. There's no reason why to not begin early. Not tying, holding surgical instruments. From early on, it's a bonus, صراحة, before residency. And that's what I did, صراحة, from the third year medical school onwards to my internship. I was already working and working and scrubbing in and working in the ORs to a resident level early on. But that's a key difference. That's something to think about. But early on, just focus on your GPA, and then things will come with time. The difference between residency and government and private hospitals. Well, if this is for my specialty in specific, there is no residency in private hospitals. So cardiac surgery is usually an academic program in government hospitals, صراحة. So there's not any center that's no program in a private hospital. I think that's all for the questions. But if you have any questions in general, Be happy to answer them.
For any more questions, inshallah, we will be having a question segment towards the end. But for now, please welcome Dr. Tariq Saleh. He will be our neurosurgery arm for today's talk.
Hello, good evening, everyone. Just give me some time to share my screen. Okay. So, same link. All right. طبعا, so first, I just want to have an idea of how many people listening to this are interested in neurosurgery. If I can see a show of hands very quick. Okay, very interesting. Okay. Okay, that's more than I expected. People usually are afraid from neurosurgery. Very nice. Okay. So neurosurgery, just very briefly, as we all know, it deals with surgical diseases of the brain, spinal cord, and the peripheral nerves. طبعا I had some slides, but I think the organizers didn't like it, so they removed it. It's fine. Yeah, it's not here. That's fine. So basically, in terms of these specific diseases that this field treats, and we can talk about very briefly the subspecialties in this field. And we have trauma, neurosurgery, and critical care. So these are things like epidural hematomas from trauma, subdural hematomas in the elderly. These are sort of general trauma neurosurgery cases. Pediatric neurosurgery deals with congenital anomalies that occur in the nervous system, myelomeningocele, congenital anomalies that occur in the brain, these kind of things that I think we're all familiar with. Neurosurgical oncology, we have skull base, which deals with mainly tumors that arise from the base of the skull. So if anyone took their neuro block, you remember the foramen rotundum, ovale, and these kind of things, the sella turcica. So lesions that arise from this area are dealt by these skull-based neurosurgeons. Vascular neurosurgery, which deals with basically the mainly arteriovenous malformations, aneurysms that occur in the cerebral arterial vein system. And the thing about vascular neurosurgery is that it's being replaced by interventional radiology. So instead of opening the skull and removing um, or sort of fixing removing a malformation or fixing a an aneurysm, they basically insert a catheter from the femoral vein and they go all the way up to the brain and stent the lesion. So it's sort of like a dying field. It's being replaced by interventional radiology by a large extent. There is functional neurosurgery. As the name suggests, this deals with diseases that affect a patient's function. So Parkinson's, for instance, which affects a patient's mobility. You have dystonia, which I think many people would be familiar with. You have tremors. So these things that affect the patient's function in their daily lives. Usually they're treated first by neurologists, but over time these diseases they progress, so they need surgical intervention where neurosurgeons would place things like electrodes deep into the brain, which regulates the electrical activity that controls any movement. This is it's a very growing field, and many people say that this is the future of neurosurgery. We have epilepsy neurosurgery. These surgeries in epilepsy neurosurgery range from removing an epileptogenic zone that's causing epilepsy. It can be inserting electrodes on the brain to sort of visualize where the epileptic zone is coming from. And again, it's very, very technical, very specialized. You have peripheral nerve neurosurgery, which has any overlap with plastic neurosurgery. So not many people specialize in peripheral nerve since the volume of cases is relatively low. And usually plastic neurosurgery, plastic surgeons, they take care of many peripheral nerve disorders. And then you have spine, which I think everyone is familiar with. Right. So this, or the structure that I made in my original PowerPoint is a bit different. So I want to touch upon the structure of the field of neurosurgery in Saudi Arabia. It's basically 6 years here in Saudi Arabia. Um, طبعا you have external rotations like general surgery, ICU, neurology, neuroradiology, and pathology. Everything else is neurosurgery. It's divided. And some months you do pediatric neurosurgery, some months you'll do oncology, some months you'll do functional, and these are the scores here. These are basically the minimal scores for neurosurgery eligibility in Riyadh. طبعا apparently many of the people in the audience are medical students, so I'm just going to make a very brief an explanation of the matching process. First, you have to have the cumulative score, which is, for example, is this score right here. And you apply with the score to Al-Hay'a. If you pass the score from Al-Hay'a, then you're eligible, you become eligible to conduct the interviews, basically. So it's a two-stage. The first stage is you get the score. The next stage is you start the interview process in different hospitals. So this is just very briefly for those who don't who are unaware of the process matching itself. And as my colleagues previously mentioned, you have a cumulative score which is based on your SMLE, your CV, and your GPA. So it's 30% for GPA, 50% for your SMLE score, and 15% for your CV. And then you have a cumulative score out of all these three components. In 2023, the minimal score was 86.12. In 2024, the minimal score was 82.51. Last year, which is our batch, the minimal score was 84.97. So as you can see, there is high variability from year to year, and it changes. So this is something you should keep in mind. There is no fixed score that you should achieve. Usually, what people usually recommend is to have a score that is at least 1 or 2 points higher than the previous year. So, for instance, last year was 84.97. So a reasonable plan would be to try and acquire a score of 86 or 87 before applying to neurosurgery this year. This is in Riyadh, and my discussion would be basically on centers here in Riyadh. I'm not fully aware of, or I don't really understand the centers outside Riyadh very much. And this is something we'll touch on later. This is specifically for those who are still in their internship, who are planning on taking the SMA exam. And for my batch, the exam was over 90% from this file called MedGuard. Things have changed now. Now, MedGuard basically was a question bank. It got leaked and people started studying from it. And the majority of the questions used to come from it. And this is why the scores are a bit high. 84.97 is considered high. However, this year, as I understand, things have changed. There is a new question bank, and MidGuard isn't as useful as it was in previous years. So my expectation is that for this year, the score will be lower than 84.97. But again, just to be safe, if you're applying this year, try to have a score of at least an 86 to make sure that you will have a position. These are some of the courses that I did. WAFA OB-GYN course for WAFA's OB-GYN course. Dr. Dijlan course. You can do this only. This is a course online, which has videos for many different surgical specialties. I recommend only doing the GS component because it provides any high yield information. The other surgical videos are relatively low yield. There's a YouTube channel called ELAF Medicine you can watch for the internal medicine. And طبعا previous questions, the more questions you solve, the higher your SMD score will be. طبعا the general plan is to solve the questions of your month and in 3 months prior. This is good, this is reasonable, but if you want to make sure you can sort of reach 86, I think it's better to solve even more questions than just 3 months prior. Okay, so this is the slide right here. I'm going to put this image in the context of spine because spine is really the field here that yields the most financial reward honestly. So yeah. So the interview process, as my colleagues mentioned before, they don't really care about your clinical knowledge very much in the interviews. If they will ask you a question, it's going to be very, very basic. And if you're already interested in neurosurgery, they'll ask you a very basic question, which you'll probably be able to answer, yani. I did 6, 7 interviews, and I think only once I was asked a clinical question. So if you're an intern who wants to prepare for your interviews, my recommendation is not to waste time reading on cases and studying for the interview. I think it'd be a waste of time. My colleague Abdulaziz mentioned something which I agree with is that the interview should be a smooth process. Don't and you try to not memorize your questions and answers. It's like a conversation that you have with the consultant who is interviewing you, basically. Um, yeah, so this is the mentality you should have. It's a conversation. You should try and be relaxed in the interview. It's not a test. It's a conversation you're having with the interviewer. Now, some of the questions that they'll ask is why our center? Um, and طبعا the questions that they will ask are all relating to navigating issues in the workplace. So, for instance, they will ask you if you have an OR that is allocated to your team, but a senior resident from a different team comes and takes this case from you. So you won't be able to work on that case anymore because a senior resident took your case from you. What would you do in this situation? So another scenario they would ask is if you're a surgery or consultant and the consultant has done something which technical which you might disagree with, and you think might harm the patient, how will you deal with this scenario? So these are the kind of sort of workplace questions that they will ask you in the interview. Basically what they're trying to see is this person that I want to work with in my department? They don't care if you have genius level knowledge. What they care about really is about your attitudes in the workplace, your work ethic, and these kind of things. Research طبعا هو as my colleagues mentioned, you only need one research to get the research point in your CV. But obviously, the more research you have, the more impressive of a CV you would have. But more important than research is for the people in the department to know who you are. If they don't know who you are, if you haven't and you worked with them before during your internship, during your medical school years, it is less likely to be the case that they will accept you. They're more likely to accept someone they already know, someone they already have experience with. And as my interview process happens long before the actual interview, and they're observing you during your work with them, during your internship, during your medical school years. They're experiencing with you, and even before the interview starts, the program director will already have formulated a list of applicants he is willing to accept. The interview is just to confirm. So this is why the interview process happens long before the interview. You have to show interest. You have to be available, as Abdulaziz mentioned. You have to be the joker, even. And this is a term that one of my senior residents has told me. You have to be the joker. You have to be available. Anytime you're free, go to to hospital. Just introduce yourself. Ask if you can join their OR. Ask if you can join their clinics. And try and be available as much as you can because this will leave a good impression. And again, they're looking for attitude, they're looking for work ethic. Don't try and not be to not be argumentative in the workplace, because you will experience many scenarios as a medical student in the hospital, as an intern, even as a resident, where you feel compelled to argue with a person who's be it a nurse or a resident or maybe a consultant or a physician for a different service. Try not be argumentative. Ignore personal remarks. Be friendly. Be respectful. Don't be too hot-tempered with your colleagues. If you're too argumentative, if you pick a fight a lot, this is considered a red flag. So, طبعا, you don't be weak that people will sort of push you over, but be respectful, يعني. there's a balance that you have to achieve. طبعا this is structure I mentioned previously. So in the first year of residency, you have 3 months of neurology, 3 months of general surgery. In the second year, you have 2 months of neuroradiology, 2 months of ICU. And this is ICU in general, it's not just neuro ICU. And then in your senior years, you have neuropathology. طبعا previously, they used to have neuropathology in R6, but this year I think they're making it in R5. And then you have 3 months elective. This can be anything you want related to neurosurgery. It can be functional, it could be spine, it could be even neurophysiology if you want. And you can do it in any time period in during your 6 years of residency training. These are the centers we have in Riyadh. طبعا in Jeddah, we have other centers outside Riyadh. There are a few good centers in Jeddah, KFSH in Jeddah. There's a center in the Eastern Province as well, which I hear is not bad. I don't know too much about them. If you're interested, I think it's better to ask someone who's already there. I'll be touching upon the centers here in Riyadh. So I'll begin with KFSH, which is the center I'm in right now. طبعا KFSH, one of the pros is that it has excellent hands-on. Even as a junior resident, you will have the opportunity to scrub in almost every surgery. Yes, when you're just beginning, your role is to hold the suction, to cut the incision. But with time, if the team starts trusting you, they will increasingly give you more and more responsibilities. And if you show any high-level skill, they might even let you work on the door itself, which is something you'd usually do in R2, R3. So there is any great opportunity for hands-on surgical skill. There is excellent exposure. We have OR cases in KFSH every day. But we have different teams. You have around 6, 7 teams. You have a pediatric team, you have a functional team, we have an oncology team, a pediatric team, and then overall, every day we have at least 3 ORs for neurosurgery. And this is an advantage which is not found in some other centers that we'll be discussing shortly. And each team has at least around on average 2, 3 ORs per week. And we have a reasonable number of residents, and this will make sense when I discuss some other centers shortly. Overall, we have around maybe 12 residents, which is very reasonable relative to the number of consultants and the number of teams we have. And it's reasonable because it's not too little that you will have a heavy workload because there is low number of residents, but also a number is not too high that it affects your exposure. So that it sort of achieved the sweet spot, you know. And on average, you have 6 to 8 on-calls per month. And the on-calls are usually light in KFSH. The reason is, as many people who are listening to this know, KFSH is a tertiary center. It doesn't deal with trauma cases. So you won't see subdural hematomas, epidural hematomas very much in KFSH. You can sometimes see subdural hematomas in inpatients, patients who are already admitted in the hospital. But the patient who had a car accident and developed a subdural hematoma would not present to KFSH. And this is the reason why the on-calls in KFSH are usually very light. You'll be able to sleep around 3 to 4 hours a night in your on-call, which is considered excellent, as compared to other centers. The cons are senior-based. What I mean by senior-based is that the junior is not involved in the discussion regarding the patients very much, discussing the cases, planning. This is all done between the consultant and the senior. The junior's role is to basically execute the plan. You're not involved in the discussion very much. In other centers, which we'll discuss shortly, you will be treated a bit differently. People will actively ask for your opinion, even your consultants, even your seniors. You'll be involved more in the discussion, which I think is a pro in other centers. Another con is that we don't have many spine cases. طبعا we have one consultant who seldomly does any spine cases, maybe once every other month. So we don't have spine cases. We don't have trauma, as I mentioned before. So what would you do as a neurosurgery resident KFSH? Because spine and trauma is very important. The compensation is that you would do these rotations, spine and trauma, in other centers during your 6 years. So it's different from, for instance, in Canada or the US. During your residency training in Saudi Arabia, and whatever program you are, whatever center you are, you can always do some months outside of your primary hospital. So, for instance, if I'm an R3, I can do my trauma my trauma rotation in Shemesi, which is known to be a trauma center. I can do spine in KFMC, which has an excellent spine department, or in King Khalid University Hospital, which also has a good number of spine cases. So basically, KFSH neurosurgery is very cranial based, يعني. And we have طبعا other than these two, we have all the other subspecialties. You have function, epilepsy, pediatric, etc. In King Khalid University Hospital, which is المستشفى الجامعي, طبعا they have two teams. There's a spine team and the cranial team, and the number of residents is relatively low, and this is the reason why the workload is very heavy. They each junior will cover 4 to 5 consultants at the same time. They would have a minimum of 8 on-calls per month. This can be more than 8 in some months. And each team has 3 to 4 clinics each week. طبعا, as I mentioned here, each team has 2 juniors. So you're not expected to see to go to the clinics, all the clinics, all the 3 to 4 clinics each week. You'll divide it with the other junior basically. But still, 3 to 4 clinics a week per team is a bit heavy. In KFSH, we have 1 clinic a week, which I think is reasonable. In KSMC, Shemesi, you don't have clinics at all. It's dealt with, it's taken care of by the specialists. طبعا the pros in King Khalid University Hospital, um, and they have a variety of specialties, especially skull-base oncology and spine. In skull-base and spine, this is the bread and butter in Al Jami. Most cases will be skull-base spine. But the feedback I had from other residents when I asked them in Al Jami is that they have excellent hands-on surgical training. The consultants are very interested, and they take so much care in ensuring that you have any good surgical exposure in the OR. You scrub in every surgery, and they let you work hands-on a lot. And in comparison to KFSH, it is not a senior-based environment. The consultant, the seniors, they will always discuss the plan with you, ask for your any inputs in the plan. And I think this trains your it trains your mind at an early stage. And the environment is friendly. A word I hear a lot is informal faculty, which is a good thing. Also in KFSH, by the way, we have an excellent environment with the consultants, with the senior residents. KSMC is basically is a trauma center, so it doesn't have many subspecialties. General neurosurgery, trauma, oncology cases, spine, pediatric. Even pediatric, actually, they had 2 pediatric consultants who recently left. So I don't know what's up with that, to be honest. So they don't have a large variety of specialties in KSMC. It's mainly a general neurosurgery center, which is very good. يعني the idea from neurosurgery residency is to be an excellent general neurosurgeon. They have good hands-on, and I did an internship in KSMC, and even as an intern, I scrubbed in most of the cases, and I was given the opportunity to participate in any basic skills like closure and these kind of things. I think it has the best environment amongst all the centers I've personally experienced. And it's very friendly to the extent that every day the whole department they have breakfast together, and every day they have one resident or one specialist who buys breakfast, and they all have breakfast together in the morning, and everyone is it's basically a group of friends. You can think of it that way. It has fewer on calls than other centers. I think there's around any 6 on-calls for the junior resident. Great teaching. When I was as an intern, the consultants took great care in teaching us. We had lots of teaching sessions in KSMC. The cons is that it has fewer OR cases. And you can sometimes go 1 week without an OR case in your team. This is not something you would usually see in KFSH or Al Jami or KFMC. As I mentioned in KFSH, we have each team would have at least 2 OR cases a week. In Shemesi, your designated team might go a week without an OR case. So I think this might affect your exposure a bit. As I mentioned before, it doesn't have many subspecialties. It doesn't have functional epilepsy. It doesn't have um, it doesn't have a vascular. It is a very general neurosurgery center. Poor facilities. What I mean by this is that if you're a resident in KSMC, regardless of what department you're in, you will face many small, silly issues that will bug you a lot. So things like when I was an intern, I remember almost every OR, I had to go back and forth from the OR to the blood bank, fighting with the blood bank to give me blood so that I can give it to anesthesia, so they can transfuse blood to the patients. This is not something you would see in other hospitals. In KFSH, I don't even think about the blood transfusion. It's always available. And there are many other examples of how these small issues will bug you if you're a resident KSMC. يعني. The facilities in KSMC are very poor. You don't have parking, etc. And the load is relatively light. And you still work hard in KSMC as a resident, but compared to other centers, the load I think is relatively light. And I put this in the cons because you want to work, you want as much exposure as you can experience. KFMC, طبعا KFMC I think it is the most neurosurgically comprehensive center in the entire country. It has all the subspecialties from A to Z. It has many OR days. It's very similar to KFSH. You'd have at least 2 or 3 neurosurgery ORs every day. طبعا the cons is that it has too many residents, too many fellows. Each year they have around 8 seats. This year they accepted 6. Sorry, last year they accepted 6 residents, which I think is a big number, yani. And when I went there as an intern, I noticed the ORs are very crowded. When I was an intern in KFSH, I scrubbed in almost every case. The same goes for in Shemesi, but in KFMC, I scrubbed in, I think, once during the entire month, and they only gave me a stitch. Yani. If it's relatively very crowded OR, and as a junior, this might affect your exposure a bit. So as mentioned, less hands-on work, very heavy load. KFMC is known for that. And the reason is طبعاً by a very heavy load, I mean the amount of hours you spend in the hospital at KFMC is above average for a typical neurosurgery center in Saudi Arabia. Uh, a resident from KFMC told me that they're expected to be at the hospital at 5:30 a.m. Because they have daily morning meetings, which doesn't exist in many other centers. And the daily morning meetings in KFMC, they take a long time. So you have to be early in the hospital to take care of the inpatient issues before the morning meeting. And after the morning meeting, you'll have to continue the work, which you could have done during the time of the morning meeting. So even the residents in KFMC, they say this a lot, and they don't have much time to study compared to residents in other centers. But they say this is compensated by the morning meetings and the teaching that they receive during the meetings. But as I mentioned, it is the most comprehensive center in the entire country in terms of the subspecialties they have. طبعا National Guard, I have absolutely no experience with Al-Haras. So I asked a fellow colleague who is from Al-Haras, and this is what the feedback that she gave me. طبعا Al-Haras combines both general cases, so trauma cases, and tertiary cases like functional epilepsies. So it has any good exposure in many subspecialties. It the colleague I have in Al-Haras, she mentioned that Al-Haras is the largest neurosurgery pediatric center in the country. The cons, it has very heavy on calls since it's a trauma center. Trauma centers usually have very heavy on calls. You don't sleep a lot during your on calls. Very heavy workload. This is true for maybe all departments in Al-Haras, not just neurosurgery. They're known for that, yani. And I mentioned they have most subspecialties, but they don't have skull base and vascular. So it's a very good center يعني. طبعا there are many other centers like العسكري, like security force, but I don't know much about them, so I refrain from touching upon them very much. طبعا this is the typical day of a resident. This will vary a lot. يعني this is something you have to keep in mind. It will vary from center to center, and it will vary within the same center from day to day. But I'll give you my typical any schedule as an R1 in KFSH. Usually I'd be in the hospital at 6:30 a.m. And let's say I have an OR that day. I take consent from the patient. There are some any preoperative any things that you must carry on that you must do before the surgery itself, and this is something you do from 6:30 a.m. to around 7 a.m. From 7 a.m. to 7:30, you can go have maybe breakfast. You can see your inpatients. And then at 7:30, the OR starts, and your ORs usually would finish at around 4 or 5 p.m. Sometimes it finish before that. Sometimes it finish after that. There's this idea that surgeries and neurosurgery take until midnight all day long, every day. And I think many people here have this misconception. And even though this can sometimes happen, it is very rare. يعني, during my internship, 3 months of neurosurgery, I spent one day I spent it until 12 midnight. Other days, the hours would typically finish at around 4, 5, maximum 6 p.m. Um, yes, and after that, and you can go home or you can join other ORs nearby in the nearby rooms. If you have clinic that day instead of an OR, you usually don't have ORs and clinics in the same day. So if you have clinic on a certain day, um, you don't have to be in the hospital at 6:30 a.m. You can be in the hospital at around any 7:30. You can see your inpatients, do rounds on them, and then the clinic would start around 8 or 8:30 a.m. And you'd finish your clinics at around 2, 3 p.m. After that, it's up to you. You can go home or you can preferably join the other ORs from the other teams to show interest يعني. I mean, this is very variable. This is in KFSH. Other centers will have a different schedule, but any you're expected to be in the hospital anywhere from 5:30 to 7:30 a.m. Even KFSH, you sometimes have to be at the hospital earlier than 6:30. So sometimes you'd be in the hospital at 6 a.m., sometimes 5:30 a.m. But typically, I would say 6:30 is very reasonable. This is the matching process. I think this can be useful for those who are still in medical school who are unaware of this process. As I mentioned, there are two stages to the application. First, you submit your GPA, your CV, your SMLE score, and this calculates your cumulative score, which we saw earlier, which was around the minimal score for neurosurgery acceptance in Riyadh was around 84.9. If you pass this score, then you're eligible for the interviews after that. And in the interviews, you'll go to each hospital and this is where your personal connections with the hospitals will be useful. You have to have the objective score before you can be eligible to do the interviews. And then the score is any objective ما في وساط في الموضوع in terms of the score. الوساط ممكن تيجي بعدين وقت الانترفيوز if you have good connections يعني and the people know you they've experienced you that is where your personal connections will help you يعني. This is the CV. You have 5 points for research publication. As mentioned previously, you just need any one research publication. Should you have more research in your CV? It's not that important to be honest. Yani, it's good. It's good, but it's not that important. The programs they will choose based on how well they know you. They will choose based on their experience with you clinically. They want to know that you are going to be a good clinical neurosurgeon. They want to know that you have good attitude. They want to know that you arrive on time. You do your tasks well. This is what they care about. They want to know that you have these qualities during the application process. طبعا. If you're an intern, you have to have this sort of work ethic, and this is what they will decide the applications on. Research is something secondary. Maybe if there any if a program director is stuck choosing between two applicants, maybe they'll resort to seeing who has more research. But really, the decision is based on your clinical work during your internship years, during your rotations in a certain hospital. Preparing as an intern, طبعاً, I notice right now there are many medical students, so we can also extend this advice to medical students. Um, you don't have to have genius level knowledge. It's perfectly fine to have very basic level knowledge and neuroanatomy and neuroradiology. As I mentioned, they don't expect too much from you in terms of knowledge. They do expect you to have good work ethic. This is what they want from you, and this is their most important metric in choosing their applicants. So if you want to read, and this is طبعا, it's very important to not to overwhelm yourself. You don't have to spend 2 or 3 hours a day reading on neurosurgery. Even as an intern, even 30 minutes a day reading on neurosurgery um, goes a long way. There is, طبعا, for me, what I think is important as someone who hasn't started the residency is to read the basic neuroanatomy and basic neuroradiology, because neuroradiology is the bread and butter of the neurosurgery. All the time, you will see the neurosurgeons, consultants, and the residents discussing cases based on neuroradiology images, MRIs and CTs. So you have to know what you're looking at, basically. If you want to understand what's happening, if you're asked to read the CT or MRI, and this will happen a lot as a junior, consultants will ask you to read an image. So don't go into details. It's perfectly fine to have a very basic understanding of neuroradiology. These are two very nice books that you can download and read off. This book has a good section on the basics of the normal anatomy of the brain. This book provides a very sort of cartoonish explanation of the normal neuroanatomy, which I think even a 5-year-old can understand. And so I think it's very good at the basic level. And all of us use Anki. There is this very nice Anki deck called the Dura deck. But before I mention this, I have to tell you that there is a very famous book and that all residents in neurosurgery use. It's called Greenberg's Neurosurgery. You'll use this almost every day as a neurosurgery resident. It's the go-to book as a neurosurgery resident worldwide. There is this nice Anki deck which is based off of this book. It covers all the chapters, creates Anki cards that covers all the chapters in this book. So I recommend maybe doing a few cards every day from this Anki deck. If anyone's interested, I can share my number with the organizers, and they share my number with anyone who wants the link to this Anki deck. On calls, طبعا, this is an important point. As an intern, many times they will not give you 24-hour on call. They will give you an on call that starts from 7 a.m. to 7 p.m. This is the case at least in KFSH. My recommendation is to voluntarily take a 24-hour on call, because this shows that you're taking the extra step. It shows that you're interested, and this is something that if you noticed, even Abdulaziz, even Hassan mentioned. This tells you that it is important to take any 24-hour on calls. Don't just stick to the scheduled on call that the department gives you. Take the extra step, show your interest. This will come a long way. It will to show that you're interested in the field. It shows that you're a hard worker, and this will reflect positively when the program director wants to choose and who choose the applicants. And this is very important for interns. Try to finish the SMLE before the neurosurgery rotations. Let's say your neurosurgery rotations start from January. By the end of December, try to be finished with SMLE. You have 3 trials. I think it's very reasonable to be finished with those 3 trials before the start of neurosurgery rotations. The reason is during your rotations in your interested field, you want to be focused solely on that rotation. Your attention, your work should be focused solely on your rotation. If you have an exam, and a very important exam you're preparing for, this will take your time. You need to take vacations during that rotation, so you won't be able to work to your full potential. And so I really think this is very important. Try as much as you can to finish your assembly before neurosurgery rotations. This is something I did, and this is something I urge um, anyone to do, whether you're interested in neurosurgery or other fields, really. This is something that I think many people will ponder on. I pondered on it myself when I was a medical student. Um, and then whether to pursue neurosurgery residency here in Saudi Arabia or abroad in Canada or the US. طبعا as Saudis, usually we think of Canada if we want to go abroad. As a medical student, my primary goal actually was to apply to Canada, because it's the cliche sort of reputation that programs abroad are better in terms of training. Now, what I can say is that Canada and the US, they have much better research opportunities than Saudi, and you'll have more opportunities to connect with international and new leaders in the field. But in terms of the actual clinical work, clinical exposure, there is not that much of a significant difference. Any, as a medical student, I used to go to, um, in my free time, I used to go to different hospitals to experience the field and you work with the residents, attend the morning meetings, attend the ORs. And I noticed that the residents are indeed working in the ORs, very good hands-on skills. I saw many residents that are competent, residents that I aspire to become, um, um, residents I want to be like. And so I noticed that the training in Saudi Arabia is actually very good, if you put in the effort. So in terms of the clinical and surgical exposure, there is no difference between Saudi Arabia and Canada or the US. Um, again, this is something personal you have to think about yourself. But again, and I think the priority from training is to be a competent clinical neurosurgeon, and you can perfectly achieve this by training here in Saudi Arabia. طبعا, put this as a separate slide to emphasize the importance of it. Attitude is more important than anything else, whether you're an intern, whether you're a resident, whether you're a medical student who's doing a rotation in any field, really. I reiterate this because of the importance. The program will choose you based on your attitude, based on your work ethic, based on your punctuality. They will not choose you based on your knowledge. They will not choose you based on how much research you have. They want you to have good clinical, good work ethic, basically. And if I'm a program director and I'm interviewing applicants, the question that I will ask myself, is this an applicant? Is this a person I want to work with? This is the question that program directors will ask themselves. طبعا these people I want to acknowledge Dr. طبعا as I mentioned, don't have much experience in many in some of these centers I talked about, so I resorted to ask some of my colleagues in those respect any department in those respected any hospitals. And thank you. If there's any question, I will be happy to answer them. Okay, so I appreciate the enthusiasm. Surgery is indeed a very interesting field. So, as a third year medical student, how do I approach hospitals for observership or similar stuff in the neurosurgery department? Well, it's very straightforward, actually. You just go to the department and join. That's literally what you have to do. Any, for instance, you can literally just go to King Faisal Hospital, go to the OR, join the OR room, ask where the neurosurgery ORs are, just go there, introduce yourself, and that's it basically. It's not a very scary process actually. It's very simple. People in the department will be very welcoming of you when you coming to them and asking to be part of the morning meeting, to be part of the OR. So people will be very welcoming, the consultant, the residents. Um, so that's literally it. You can just go inside the hospital and you ask where the neurosurgery ORs are and just join. Or you can attend the morning meetings as well. Um, in KFSH, for instance, we have morning meetings on Sunday and Thursday that start around 7:30 a.m. in the postgraduate center. So anytime you can just join and introduce yourself. And the first time it will feel very weird. You will feel very lost. But if you do this any continuously, you'll become more comfortable. You'll become more confident, and the department will know you better. And this will be very useful, especially later on when you start applying any. But it's a very simple process. Just go to the hospital, ask where the neurosurgeons are, go to neurosurgeons and introduce yourself. Tell them I want to join your rounds. I want to join the morning meetings. I want to join the OR. Okay. When do you start? Recommendation letters, you collect them at the end of rotation. So if you're doing a rotation in during your medical school years in the summer, at the end of the rotation, go to a consultant and ask them for a recommendation letter. And same thing during internship. If you finish a rotation during an internship, at the end of the month, go to the consultant and ask for a recommendation letter. And you can ask multiple consultants, by the way, any conferences. How does a panel interview go? Okay, yes. How to prepare for the interview? What was your approach? What if you don't know the answer to the clinical question they asked? Okay. So any conferences, um, yes, I think this is a very good point. There is a yearly conference called the Saudi Annual Neurosurgery Conference. They hold it every year. Each year it's in a different city. Um, this is basically the go-to conference that you want to attend. And then there's one coming up in Jeddah in Feb. I think it's in April. Yes, April the 3rd. So you can find links of it in Twitter, how to apply, how to attend. And my suggestion is to try and submit a paper, even if it's not published, even if it's um, just a poster presentation. Submit a paper, and the conference is usually very welcoming of students who are any applying research papers. At least have a poster presentation at the conference. That comes a long way. And this is actually the norm right now. It would be very unusual for an applicant not to have a poster presentation at least in one of these and in this conference. So it's something that's sort of given, you know, you have to have at least one presentation in this conference as a student or as an intern. It could be a poster presentation, it could be a sort of presentation in front of a crowd. How to prepare for the interview? You can simply prepare for it the day before. يعني, it's not a very difficult process. But شوف, you have to keep in mind that the interview process happens long before the interview itself. The program director will have already decided who they want before the interview. The interview is just to confirm. Me personally, I simply asked residents from each department, from each hospital, what questions they received during their interviews. Um, and they're usually very straightforward. Um, the interview is not a test; it's a conversation you're having with the uh, with the doctors. Yani. Again, some of the questions that they ask me or pertaining to things that you'll deal in your workplace. Yani. Things like what would you do if a resident isn't giving you enough work? Um, what would you do if a consultant did something wrong? How would you approach? So they want to see how you would approach these certain issues, Yani. And this is why what would you do if you don't answer the clinical question? It's perfectly fine. It's perfectly fine. It's not going to be a decisive point. The interviewers will not think that since this applicant was not able to answer our clinical question, we will not any accept this applicant. That's not how it goes, really. Um, so even if you don't answer the clinical question, it's perfectly fine, because they want someone who has good work ethic, someone they want to work with. They don't want someone who has genius level knowledge at an early stage. That's not what they're looking for, because everyone knows knowledge will accumulate with time. No one expects you to have good knowledge as a junior, as an intern or as a junior resident even. So it's perfectly fine. You don't sweat it, basically. Yes, any more questions? Be happy to take them. Do you rotate between centers during residency? Yes, generally, yes. طبعا you have things like joint program. طبعا the programs in Saudi Arabia are divided into joint programs and non-joint programs. Joint programs will include things like Shemesi, Askari, Al Jami. So these three centers, they're a joint program, which means that if you, for instance, apply to Shemesi and you're a resident in Shemesi, you have a schedule that will let you rotate in Al Jami in certain rotations and rotate in Askari in certain rotations. So it's basically part of your schedule. But certain other centers that are not joint programs, like a KFSH, um, في الأصل إنه in KFSH you spend the entire 6 years in KFSH, but usually what happens is that somewhere along the road you will take certain rotations outside KFSH. But this is not part of your schedule. This is something that you will apply for. So maybe as an R3 you will apply for a trauma neurosurgery rotation in Shemesi. As an R6 you will apply for a certain other rotation in Al Jami, for instance. So, or you can stay the entire 6 years in KFSH, and it's up to you. But rotating from different centers is not part of your schedule. Okay, how do you keep grit, both physical and mental, to keep you going in your journey? Some residents told me dropout rates are high, especially until R3. Um, well, honestly, I don't have an advice more than try to experience the field as much as you can during your medical school. If you're interested in neurosurgery during medical school, that's great because you sort of have good time to experience the field as much as you can. So experience it during your medical school's experience it during internship, and then decide. At that time, you will have had an idea of whether this field is suitable for you or not. By the end of your rotations internship, you will have an idea of whether you want to pursue neurosurgery or not. How do you develop if you have chosen neurosurgery um, and you want to develop grit both physically and mentally? Um, Honestly, I'm not sure how to answer that question. It's something that you learn along the way, really. And into you'll try and create a schedule every day. Neurosurgery is hectic. Maybe not as Abdulaziz Alaklabi has told us about cardiac surgery. You definitely don't usually return home at around 9, 10 p.m., but it is considered hectic. So you will be fatigued both physically and mentally. The good thing is there is variability. Some days will be very heavy, some days will be very light. Um, and, uh, and and yeah, and there's I don't think there's something that you can actively do to keep a positive mental state. I think it's better that before you decide to pursue neurosurgery, to experience the field as much as you can to decide in the first place if this is for you or not. يعني. And yeah, the
All right.
dropout
Thank
rates are high until R3. I personally haven't, and at least in KFSH, I haven't noticed dropout rates. Um, even in other specialties, even in other hospitals, I haven't noticed high any dropout rates. Because usually people who apply to neurosurgery will have experienced it extensively beforehand and have decided this is indeed for them. And yeah, thank
All
you.
right, thank you so much, guys. Thank you, Dr. Tariq, for all your insights. MashaAllah, that was very inclusive. And thank you all for sharing your insights. For any more questions, inshallah, we will be completing the question segments towards the end. But for now, please give a warm welcome to Dr. Abdulaziz AlMosa. He is our plastic surgeon speaker for today and the last speaker on this panel. So please give a warm welcome.
Thank you, Lotus. Thank you for having me. This is Abdulaziz AlMosa. I'm a plastic surgery resident doing my third year currently at King Faisal Specialist Hospital. If one of the organizers can share the screen so we can see the slides, please.
One second, doctor. I'll be sharing it soon.
Sure, thank you. Well, actually, I'm on call today, so there are some pending cases in the ER. So my talk will be brief, but alhamdulillah, my colleagues I think, did a good job covering most of the parts regarding the matching process. So in my slide, I'll only focus on things related to plastic surgery. So first of all, I think there is some misconception that we don't get exposed enough to plastics during our medical schools in our curriculum. But if you think about it, you study plastics during studying anatomy of the upper extremity, when you read slides regarding head and neck anatomy, breast and trunk anatomy, lower extremity, all these stuff are related to plastic surgery, because if you want to define plastic surgery, it is a specialty of principle rather than anatomical position. So we can see plastic everywhere during your whole medical school. So if you want to think of the matching process, I think everyone knows that plastic surgery is very competitive. But if you want to think of it as a steps, it's actually two steps. First step is nomination. The second step is actually matching. So nomination, don't get too focused on. Don't think that you have to get nominated this year or from your first try. Actually, when I get nominated 3 years ago, all my colleague interns have eventually matched during these 3 years, whether they have matched it during the first year, second year, or third year. You will have your time, but just focus on your career rather than this year, okay? So get your SMRE score, get your GPA, but don't be very focused on, because you have all the time to get your match. But when you get matched during your interviews, it is tricky. It is different than other specialties because it is based on recommendations rather than your CV. Even if you have done a lot of research, a lot of conferences, and all that stuff, if nobody recommends you, you will not get your match, because usually the Saudi Council nominate more people than the seats. So in my year, I think they have nominated 13 candidates, but there was around 9 seats. So 4 people will not match. So how can you make sure that you will have your seat? You have to get your recommendations. So how to get your recommendations? You have to be active with different residents in different centers. So start to have your electives, your rotations from your medical years. Don't have to wait to your internship, because usually in your internship you will have only 2 to 3 electives. But in Riyadh, we have like 6 centers of plastic surgery. So when you are a medical student, start to think about that. So since we are talking about the centers, let's talk about the history of plastic surgery training program in Saudi Arabia. When it first started in 2012, it was a one big joint program. And that was the case until 2018, when National Guard Health Affairs, or Haras, got separated in 2018. 4 years later, KFSH, or King Faisal Special Hospital, also started to function as a separate program. Now, I think the King or Prince Sultan Military Hospital is a separate program. What I'm hearing now is King Faisal, King Fahad Medical City will be a separate program. So I think in the future, every center will be separate. So you have to have your electives in every center that you can have, at least 5 second centers, because I think chances of getting matched in a center that you have not taken an elective in is almost 0. So the first step to increase your chances of getting a match is having your electives, having your summer electives, having your electives during your internship, or having clinical attachment or services if you don't get matched during the first year. Then you will notice that the interviews are a little bit different. Of course, they will ask about why do you choose the specialty, talk about yourself, but one common question that I've got asked in every interview is, they will show you your CV, they will show you the recommendation letters, and they will ask you, choose one person from the recommendation recommendations, and we will call right now and we'll ask him about you. If he recommends you, we can ensure that you can get a seat here. So this question is very tricky because we don't want to be overconfident and saying this consultant will recommend me. But we have to make sure that before entering the interview, you have at least one name that he will actually remember you and can recommend you. Usually you can get that during surface years or attachment, but you don't have to be a surface resident to match in the program. In terms of residency, we have a 6-year program in Saudi Arabia. I think it's 5 in Canada, but in Saudi Arabia it's 6. It is different than other specialties because you don't actually start doing plastic surgery until the 3rd year. The first 2 years are called surgical foundations. You will rotate in ENT, in general surgery, orthopedic, vascular surgery, also will rotate in ICU, ER rotations. Then you will have also some electives you can take in pediatric surgery, dermatology. Also, you can have plastic surgery as electives, but this will be, you will get your time in plastic surgery. You don't have to try it even in your electives. But starting from the 3rd year, you will start rotating exclusively in plastic surgery. So first 2 years are surgical foundation. R3 and R4, you are considered as a junior resident. R5 and R6 are the senior years. It's a little bit long, but it is diverse. In terms of subspecialties, usually we rotate as one team. Like in KFSH, we have 8 consultants. We have consultants specialized in craniofacial, we have consultants specialized in hand surgeries, we have consultants specialized in plastic surgery. So you don't have different rotations, you have different consultants. So Sunday we will work with the consultant that is specialized in hand. Monday we'll work with consultant in clips and clip pallets. And Monday or Tuesday with breast. So you will have different subspecialties during your whole training without having specific rotations. In terms of different centers, as I mentioned, we used to have one big joint program. Now everyone is being separate. So I don't believe that you have the privilege to choose the center in plastic surgery. You just wish to work to get a seat. So during your internship, try to have electives in different centers. Don't have 2 electives in one center. This will be a red flag in your CV because every other center will think that you want that specific center. Other thing I think was mentioned previously by one of my colleagues is if you don't take an elective in a specific center, they will ask you during that interview. They will say you have 5 electives, but you haven't been in our center. Why is that? Do you think we are not worth your time, or explain yourself? They will be very hostile in the interviews. They will try to see your personality and attitude. You can answer that wisely. You can say you have tried, there is not enough seats, there is not enough timing. But usually, if you get in that position, your chances in getting a match in that center is very low. So always try to get your elective from as soon as you can. In terms of environment, I think I've worked or at least had rotation in every center. I think the environment is a little bit similar. Plastic surgery is popular that it's a little bit toxic, but you will get used to it. It is part of the specialty. Everyone will try to have this idea of the hierarchy. You should respect your seniors. You should treat them as not only senior residents, but then your tutors, because they actually are. Everyone teaches the one after them. In terms of environment, as I mentioned, it's similar. I don't think that one center is better than others. There is no one Excel center in Saudi Arabia. Currently, King Faisal Specialty Hospital is growing. We think are started to think about increasing our number of seats per year. Currently, we take 1 resident per year, but I think now the program director is having some talks with the Saudi Council to increase the number to 2 residents, which will be very helpful to us, because I believe now we are in a shortage in terms of ratio. There is like 3 consultants or 2 consultants to each resident, because we don't count the R1s and R2s. In our center, we have only 4 residents, R3, R4, R5, R6. R6 residents usually are busy with the board exam, so in the hospital you don't see only the R5s, R4s, and R3s. So maybe next year we'll take 2 residents, which is hopefully the case. The workload is hectic, mainly due to shortage of resident numbers. The number of patients is similar to other specialties, but the number of residents is much more lower. So that is an issue. If I want to give one recommendation for interns, this thing that I haven't done during my internship, but I think it will make a big difference for candidates. When you try to plan your internship, don't put your elective in plastic surgery in what they call the golden months, because it will be very crowded, very busy, 3-4 interns per rotation. But if you take it during, let's say, the earlier months like September, October, August, you will be the only intern. Usually we don't have any rotator residents there. Usually we work 3 residents and that intern. And by this, you can really prove yourself. So usually during interviews, we remember the interns that they came in August, September, October, rather than interns they came in January, February, or March. So this is very important thing that I've noticed only during my residency. Then when you get your nomination, you can prepare for your interviews by getting your recommendations. You will have to have your rotation in that specific center in order to get a seat. But usually it is something that goes smoothly. Don't overthink it, especially in the interviews. The chances are with you, because the number of seats is like 80 or 90% of the candidates will get their matches, only 10%. So don't make the red flags like being overconfident or saying that you have chosen specialty because of the financial outcome. Other than that, hopefully it will go smoothly. I think by this I reached my conclusion. If you have any questions, please feel free.
All right. Thank you so much, Dr. Abdulaziz. Thank you so much for your insights. This was super helpful. And now, finally, last but not least, we will be moving on to our Q&A session. Mashallah, everyone was super interactive and asked a lot of questions. But if you missed the chance to ask a question in between the segments, then this is your chance to share your question with one of these doctors. The chat's open, or you can feel free to unmute your mics and ask the doctors a question. To make it easier for the doctors to answer, please make sure to include which specialty you're interested in, or which specialty is the target of that question.
Regarding the GPA, like we said, there's a scoring system. You can calculate it yourself. There is no specific GPA. You just want to reach that threshold, like Dr. Tariq said, above, like 2 points above the previous year is like a good goal, to set in mind. But there is no specific GPA. Just aim for a good SMLE score. That's what I recommend. And try your best during your medical school to get as good of a GPA as possible.
Dr. Abdulaziz AlMosa, a question for you, which is, what cumulative score is needed at least to match?
Well, actually, this changes depending on the year. I think in my year 3 years ago, it was 89.9, but the thing is, there has been some changes in the CV points. So you have to be updated with the latest announcement from the Saudi Council. But however, try to get your highest SMLE score. I think SMLE is the key point in getting an because if you get the highest score that year, you will match for sure. So don't think of specific number, try your best, and you will get your match. So whether this year or the year after.
Doctor, another question for you, which says, how many exams are required during plastic surgery residency? Are they concluded annually or only at the beginning or the end of training?
So in terms of exams in plastic surgery, I think similar to other specialties, we have our annual promotion exams, and we have our part exam that you can take during your junior years. The part exam is mainly general surgery, because during your first 2 years of plastic surgery, you will be rotating different surgical specialties rather than plastic. But then you will have your annual promotion exam. But usually these exams are MCQs, and they are not the actual issue in your residency. You will have to have your own specific reading, your own specific work rather than just examinations.
Any more questions, guys? Okay, I think that's it for our question segment. Before we wrap up, I want to give a huge thank you to all the doctors of all specialties who took place to join us in this esteemed panel. MashaAllah, all of the advice was extremely helpful and extremely inclusive, and as if giving insights from internship time in of itself. يعني من قلب الحدث ما شاء الله. And sharing their experience and insight. Thank you so much. We truly appreciate your generosity and your guidance. Thank you to everyone who attended. Thank you for your participation. Your questions definitely added to the conversation and expanded the insights that the doctors could share and helped the doctors communicate with you more effectively. This was really beneficial, and we hope this talk was helpful and beneficial for you guys to prepare for your upcoming cycle or this cycle. So best of luck to everyone from the Surgery and Interest Group team. We wish you guys best of luck on your applications to whoever is applying this cycle. And we hope this talk was insightful to even upcoming batches who are interested in applying to upcoming residency cycles. With that, we'll go ahead and close the talk. Thank you all so much. Have a great rest of your night.
Thank you.